Okay, I want you to imagine surgery that's so incredibly precise, it's happening on a scale that's almost invisible to the naked eye. We're about to dive into a medical revolution where, the biggest, most life-changing challenges are actually solved with the absolute tiniest of solutions.
And that really is the core question, isn't it? How on earth do surgeons repair something they can barely see? How do they reconnect these tiny, delicate vessels, we're talking smaller than a single millimeter, to get the body's natural systems working again? Well, let's find out.
You see, for millions of cancer survivors, the fight doesn't just stop when they go into remission. A whole new battle can begin. It's a chronic, often painful condition that becomes this constant reminder of everything they've been through, and it can change their lives forever.
So the problem lies deep inside a system that honestly we rarely even think about until it breaks. I'm talking about our body's internal drainage network, and when this incredibly complex plumbing system gets damaged, well, the consequences can be really, really severe.
This condition has a name. It's called lymphedema, and it happens when that lymphatic system gets compromised. Fluid that's supposed to be flowing just gets trapped. This leads to chronic, painful swelling, usually in the arms or the legs. And this is the problem that the surgeons we're talking about are so determined to solve.
And the solution, wow, it's found in the incredible field of super microsurgery. Surgeons have developed these truly groundbreaking techniques that don't just, manage the symptoms, they actually aim to fix the underlying plumbing problem itself.
We're going to focus on two key techniques here. First, there's LVA. Its whole goal is to create a microscopic bypass to get things flowing again. And second, we have the SCIP flap, which is basically a living tissue transplant used to rebuild damaged areas. So two different tools for two very related problems.
All right, let's dive into our first technique. Now, the name sounds super complex, but the concept behind it is actually brilliantly simple. It's called lymphaticovenous anastomosis, or just LVA for short.
Think of LVA like this. If you've got a blocked drainage pipe in your yard, what do? You build a new channel to redirect the water, right? That is exactly what LVA does, but on a mind-bogglingly small scale. It connects a blocked lymphatic vessel to a tiny vein right next to it, giving all that trapped fluid a brand new escape route. So, conceptually, the whole procedure is like this three-step dance of incredible precision. First, the surgeons have to identify the exact lymphatic vessel that's blocked. Next, they locate a good, healthy vein nearby. And then, and this is the amazing part, they meticulously suture them together, creating a totally new, functional connection.
And this quote right here, it highlights something that is just remarkable. You'd think this kind of surgery would require some kind of sci-fi technology, but as Professor Isao FL pointed out about Dr. Sachin Chavre's work, incredible accuracy and amazing results could be achieved with pure skill, even with pretty basic equipment.
So we've seen how surgeons can reroute flow, but what about when you need to rebuild the structure itself? Well, for that, let's look at a technique that's kind of like biological sculpting, the incredibly versatile SCIP flap.
Now, a SCIP flap is way more than just a skin graft. It's a whole living section of tissue. We're talking skin, fat, and its own arteries and veins that gets carefully moved from one part of the body to another. It's like a self-sustaining, living patch that can be used to reconstruct everything from a jawbone to the tip of a finger.
And this just shows you how incredibly versatile the technique is. Professor Prof Koshima, who has over 40 years of experience, has used SCIP flaps for an astonishing range of reconstructions, rebuilding hands, treating really complex vascular issues, and even focusing on the aesthetics for younger patients. It's amazing.
So the crucial point here is that these aren't just routine procedures. LVA and SCIP flaps are tools, right? They're tools that let surgeons tackle some of the most complex and challenging cases in all of medicine, constantly pushing the boundaries of what we thought was even possible.
But, with innovation comes debate. Take a rare cancer called angiosarcoma. There's a really critical question. Could performing LVA actually help cancer cells spread? Or, and this is Professor Isau's counterpoint, could it potentially trigger the body's own immune system to fight the cancer? It's a profound dilemma, and it really gets to the heart of medical progress, weighing a potential cure against a very real potential risk. And this isn't just a theory. Professor Isao actually points to his own experience, a 65% success rate in cases where he believes the LVA procedure helped to activate the body's own anti-cancer immunity. That is a compelling, but definitely risky potential benefit.
The complexity of these cases is just breathtaking. From tackling lymphedema and cancer at the same time,
to reconstructing a severely deformed hand after previous treatments have failed, every single patient is a unique, incredibly difficult puzzle.
And on top of these medical puzzles, you have all these real-world challenges. Surgeons all over the globe have to adapt. They're dealing with the high cost of anesthesia, maybe a lack of advanced diagnostic tools, and the absolutely critical need to manage patient expectations, especially when long-term follow-up or even more surgeries might be needed down the road.
And this really brings us to the ultimate takeaway from all these expert discussions. The work is nowhere near done. The techniques are there, they're established, but the future, finding new ways to use them, refining the methods, overcoming these global barriers, all of that rests on the shoulders of the next generation of innovators.
It really makes you wonder, doesn't it? If today's surgeons can repair things that are nearly invisible, what impossible challenges are they going to solve tomorrow? What will that next frontier of surgery, the one that's beyond our sight, truly look like?